It is of utmost importance that schools reopen in September. That's according to experts and doctors at SickKids Hospital, who say they are literally losing sleep over the mental and behavioral impacts of not having children in school. Today, they released recommendations on how to safely reopen them.
We have to stop living in fear from the virus. And most importantly, we need to move on with certain activities of our life.
While they say it was absolutely the right decision to shut down schools after March break, doctors at SickKids now say there's enough research to safely reopen them.
Children, by and large, do not get very sick from coronavirus.
In Canada, children and youth under 18 make up less than 5% of the total number of COVID-19 cases. At SickKids, of the 5,000 symptomatic children tested for COVID-19 since March, less than 30 children tested positive. The hospital also tested 1,500 asymptomatic children, and none of them tested positive. There's an extremely low death and hospitalization rate for children around the world, and only 7 COVID-positive children have required admission at SickKids.
COVID-19 causes a less severe presentation in children.
As for how they transmit the virus to adults, researchers say there is growing data from parts of the world where schools are already open.
Children may in fact not be the super spreaders that we thought there would be.
Given all this, with safety precautions in place, doctors believe it is imperative that schools reopen in September.
Kids have had a repeated experience of loss and grief.
There is growing evidence to suggest a significant proportion of children have experienced increased depression, anxiety, and irritability. And for children in vulnerable situations, this has also increased exposure to domestic violence and abuse.
Schools are sometimes the safest environment for children.
In their recommendations, they advise regular hand washing, making sure symptomatic children are staying home from school, canceling large assemblies, and arranging desks to leave space between students. But they specify masks should not be required.
You can imagine in younger children, masks can be irritating, which may lead to increased touching of their face or eyes or nose, which could increase the risk of infection.
But parents and teachers are concerned about how to protect staff, especially those who are immunocompromised and won't be able to immediately return to school.
Their jobs will be protected just like everyone else's job is protected.
And while SickKids experts want to move forward, leaders aren't so sure.
I really think that there are a lot of experts that need to be brought to the table for a broader discussion in regards to how we move forward.
In a statement, Education Minister Stephen Lecce says he is working with the best medical leaders in Canada, including those here at SickKids Hospital. He says they are preparing for all scenarios with an emphasis on the safety of students and staff. For City News, I'm Yazdani.